I'm going to hand over to Dr. Murray. We only have about 15 minutes left. And Dr. Murray, is going to talk to us about some of the evidence-based strategies to diagnose burnout and mental health complications of COVID, but also how can we support our colleagues and us as healthcare workers on the front line. So Dr. Murray, can I hand over to you, please? Thank you so much. And thank you for our panel for that interactive discussion. There's just so much to say, and I hate to cut it short.
Yes, I'm so honored to be here. It's been wonderful to hear the case presentation and the discussion. And I think given that, I'll adjust a little bit what I was going to talk about and try to make it shorter so we can continue that rich discussion. So this, I believe, has already been talked a lot about, that being a healthcare worker can be very stressful. And we were just hearing some of those impacts of anxiety and stress and depression. We also, of course, in data then see lower productivity, medical errors, and in many countries are starting to see healthcare workers leave the field altogether, which is really a shame. So in crises like COVID, of course, we're all seeing that this worsens and leads to much more limited resources and just more stress on everyone in the workplace. Again, I feel like this is probably something very familiar to all of you. And I think one of the things that we really try to stress here with common signs is that many of these are very normal. And so we're really trying to work with healthcare workers to say, these are changes that are happening within COVID that are normal, because it's a normal human reaction to something that's very different. And so what we try to focus on is just awareness. Really try to look for things like this. Are you having more difficulty concentrating on the floor? Is your eating and sleeping habits changing? So trying to look for little signs that are normal, may not indicate a big problem yet, but the earlier you catch them, of course, the better. Leading into that, this is something that we talk a lot, and I imagine others on this webinar who have mental health backgrounds do too. We often talk with professionals and healthcare workers about finding your early sign. And what that means is that the human body responds in very interesting ways per individual. I'll just give you a personal example. As part of my training here in the United States, we would do ride-alongs to domestic violence situations. And so we'd be on the scene of a very intense, often difficult to see, where someone had died or someone's very hurt. And part of our training was to find what in our bodies reacted immediately and told us that we weren't going to be okay on the scene. And for me, my palms get this very tingly feeling, but it's very easy to miss. And it can be, if I just go like this, it's fine. But for me, that's my early sign that it's a very, very early sign. It's before eating and sleeping habits change. It's before any breakdown really occurs. For me, though, that's a sign of, okay, I need to walk away and just gather myself a little bit. And so this is something we're really encouraging healthcare workers, especially as COVID has gotten very intense at certain times on the floor, is taking some time to become very aware of that so that we can prevent some of the stress and burnout rather than dealing with it once it gets fairly severe. So another thing that we talk about, I'm sure, unfortunately, so many on this phone call have had to deal with death, and a lot more of it perhaps than in your regular work before COVID. So here are just some tips and tricks, and perhaps you already do this as part of your training. We've worked with healthcare workers around the globe to work to deliver death messages so that when you have to tell a family member or just even tell coworkers, that it becomes a bit more automatic rather than creating the stress of I have to tell, worrying about it, and then going and having what could perhaps be not a very positive experience. So really understanding, how do you respond to death? And what I mean by that is, for example, some of our female healthcare workers with a child or a young adult the same age as someone who dies from COVID would respond differently to that death than perhaps someone who doesn't have a child at that age. And so really understanding, how do you respond to death? Does it vary with age and gender? Being prepared of how do you deliver messages of death, and what do you as a healthcare worker need to do after that delivery to take care of yourself? Because often, of course, healthcare workers, you're on to the next thing. And to a certain extent, you have to be. So what fits in with this? And then, of course, we've talked a lot about just educating on the grief process and making sure healthcare workers know where you are on that journey with all the death that you're seeing. I have in my slides, which I'm happy to share, just some easy things that we've started spreading around globally to healthcare workers, of just promoting things like self-awareness, that it's okay to talk about things, that it's okay to take a minute to understand, what am I saying to myself now? For example, I could have done more, or I should have done more. So good reminders for teams on the floors. This is another thing that perhaps you've seen. We try to talk about mental health of healthcare workers with COVID in zones, right? And we move within these zones. So when COVID is very intense in a country for a while, there tends to be more movement to the fear zone. And again, it's an awareness. It's not right or wrong. It's just knowing where you are. And that helps your ability to engage in certain activities to move where you want to go. Bhakti, you'd asked me to talk a little bit about assessment. Again, happy to send this out. There's really good evidence-based assessments for burnout. This one in particular measures, you see these 3 separate scales of emotional exhaustion, depersonalization, and personal accomplishment. Many of them are very similar that you'll see. One of the downsides, unfortunately, is the more evidence-based, unfortunately, sometimes you have to purchase them and they cost money. So I do believe this Copenhagen burnout inventory is free. It is also very evidence-based. And I just wanted to just show you some of the questions. It's very short, very quick. And what you see here from a mental health perspective is that what you're really asking is, what are you saying to yourself? You know, I can't take it anymore. I can't do this. Are you physically and emotionally exhausted? So this can be used as an awareness tool. Again, we try to get away from saying you're good, you're bad, you're healthy, you're unhealthy, but realize that within COVID, there's going to be a constant movement across all this. And awareness is your best tool to really prevent. Again, just another reminder, and something that we've put on a lot of floors for healthcare workers. Just what can you do each day to help a little bit to take care of yourself? Because often so many of you are so selfless taking care of others, you forget to take care of yourself. I just want to spend a little bit of time talking about some evidence-based approaches, and I'm going to do this very briefly, and then we can move on to discussion. One of the things we know about with evidence-based is that any care for healthcare workers should be a system, meaning there should be assessment, there should be triage based on need. Some will just need that self-awareness and assessment, some will need prevention, and some may actually need some more significant treatments. And then always tracking and monitoring, because again, as human beings, we're going to keep moving between our health. We have a client monitoring form, which I'm happy to hear. This focuses on mental health and behavioral health issues. So a little different than the burnout ones we saw, but also addresses things going on at home. So with many healthcare workers, what we have seen is that it's other stressors in their life also that is really leading to some reactions. So there might be violence at home or some issues with children.
Laura, I believe you're on mute.
Oh, sorry about that. Not sure how that happened. Thank you, Bhakti. One of the big things that we think is very important with the common elements approach is just being able to move throughout the triangles of need. So from wellness all the way up. I'm not going to get into this as much, but what I do want to highlight is that something like the common elements approach addresses a very wide range of problems and also these levels of severity. So in healthcare workers, for example, an healthcare worker advocate could do a 20-minute, very quick prevention awareness session and really be able to help identify those that might need more intensive treatment. Again, I'll send this out. These are just some, for those of you that are mental health workers, you'll see in here that it's nothing strange. It's your typical, we're teaching in prevention how to think in a different way, how to work on problem solving. And then once you get to mild to severe, we're doing some more of that cognitive behavioral work. I'm going to end on this, and this is something we do in prevention and work with healthcare workers a lot around the globe right now. It's just, this is cognitive work. This is retraining the brain. Some of you might know it as growth mindset, highly effective for everyone, not just those having challenges, but just all of us day to day. And essentially, it's just addressing the idea that we have unhelpful thoughts that we do have control of, even if we don't have control of the situation, and that leads to different feelings and different behaviors. So for example, you could go to the floor and just sort of say, I'm not prepared, and your feelings could be worried, frustrated, and nervous, and you become very impatient with others, not taking the time, not sleeping well. A more helpful thought is something as simple as, I'm not prepared as I would like to be, but there's others around me that have more experience that I can turn to for help. Still worried and nervous, but at these lower levels really changes your behavior and your reaction to your whole nervous system, as I'm sure other folks on the panel can talk about. These are different thoughts that we've received from a lot of healthcare workers around the globe. I will be putting my family at risk. A more helpful thought may be, I have ways to protect my family. We hear a lot of, what if I make a mistake, or I didn't sign up for this, or I'll not be able to handle the deaths. So here you just see some of the more helpful thoughts. And they're not extreme or fake, but they're just a little bit of a movement. And I'm going to end there and just turn it back to you, Bhakti.
Thank you so much. And, I, for one, after hearing Laura's presentation, just feel more reassured, right? I think as a community, there's 300 people almost on this call. We can all work together. There are well-established tools, initiatives led by NIMHANS and the state of Karnataka show us that there's resources available. So for all the healthcare workers that have joined us here today, this is a teaser, right? These are teasers of activities that you can adopt yourself at your health facilities, at your institutions, to champion each other and decrease the likelihood of burnout. I will also say, the post-test today was different compared to what we have done previously. The post-test today was a self-reflection exercise for all the individuals who are here. And if on that post-test you end up saying, I strongly agree, or I moderately agree to any of the questions, that means you would benefit from taking a moment to self-reflect and seek further help to deal with your stress around COVID-19. So, please do this post-test humbly. It's not for sharing or dissemination. It is for you to take a moment to check in with yourselves. And thank you so much for participating in that exercise. So I'm going to wrap up our session today, if you'll permit me. As I keep on saying, this is the very last session that we have for our work here today with the JHU COVID-19 series. And, I think we left the most important topic for last. So I want to just take a moment to thank all of our panelists here for participating today. They are all here available as resources for you if you need help or if you're looking to implement some of the strategies we talked about in the talk at your own health facilities. This has been a series of 10 sessions. It's taken a lot of experts, a lot of coordination, and I want to do a shout out to our RISE India colleagues for putting this all together. In case you missed some of those topics, please take your camera phones very quickly and open up the website at the end of this QR code. It will take you to a web page that includes all of the recordings for all of the sessions, and then a link to a synthesized evidence-based review of the activities or the topics that were discussed, and it should be very, very, very easy for you to use. This isn't the end of RISE programming. There is a number of activities that are happening at each of your health facilities. If you're interested in participating, or if you have innovations that you are championing, that you want to disseminate pan-India, then please reach out to these individuals, Dr. Mohanty, Sarma, and Jen Daniels, and they will be able to help coordinate you to the right hubs and spokes, and also discuss if there's opportunities for partnership. A lot of the webinar series has focused just on the clinical case management of COVID and its relation to health. However, our work across RISE far expands that domain only. Other activities that RISE is championing across India include strengthening the oxygen ecosystem. That includes assessments of facility readiness for oxygen capacity, providing training to biomedical engineers, improving supply chains for oxygen delivery, clinical case management of COVID. We're putting together a number of workshops, strategies for training of healthcare workers, not just physicians, but nurses and other ancillary services. We have a whole focus on lab strengthening, implementing efficient, effective, high quality laboratory systems within health facilities to improve our in-facility-based surveillance, and then also that linkage to whole genome sequencing and identification of future variants, all for future pandemic response. RISE has been championing vaccination programs, pan-India, trying to hit hard-hit communities, rural communities that haven't had access. And then we also have a component of work on biomedical waste management. So again, there's a lot of things that are happening through the RISE project. We have identified hubs and centers of excellence that are contributing actively across India, but also trying to develop a learning network, right? So it's different states, different hubs, innovate and implement different interventions. We're trying to learn to see what works and what can be scaled up. So there's a lot of stuff happening. I don't think this is the last time that I will have the pleasure of hosting one of these sessions. In particular, I can already promise that colleagues from NIMHANS have agreed to work with us to put together a mini workshop on healthcare worker resilience. So please watch this space, stay in contact with your RISE colleagues, and please go to the website to access any of the resources that we have presented. I do like to end on time, and so I think I am able to do that today. So I just want to thank everybody for their participation, and especially my co-panelists today for your contributions to the discussion.